Well, first of all, thank you, Brandon, for the opportunity to discuss our study. First of all, I'm particularly proud to share this work because it comes from a global collaboration, a purely academic effort that involved 78 institutions worldwide and that created probably the largest global cohort of BRCA carriers with a diagnosis of breast cancer at a young age. So this paper that I'm discussing today was an international retrospective cohort study that included more than 4,700 women diagnosed with invasive breast cancer at age of 40 years or younger and known to carry a germline pathogenic variant in the BRCA1 or BRCA2 genes. So in this analysis, we addressed one main question. Is breastfeeding safe for women who are BRCA carriers and had a child after a diagnosis of breast cancer at a young age, meaning 40 years or younger? And of all the analyzed women, this large cohort of more than 4,700 women, we extracted those who actually had a pregnancy, had a baby, and were potentially able to breastfeed, because some of them could not, of course, because, for instance, underwent a bilateral mastectomy. So of this large cohort that was made of 178 women, finally, that met all the eligibility criteria, we observed that approximately 60% of them breastfed and 40% did not. So when comparing the outcomes of these two groups, namely the patients who breastfed and those who did not, we didn't see any significant difference in terms of survival outcomes. Namely, patients who breastfed did not have a higher risk of relapse. They did not have any difference in terms of disease-free survival and no difference in terms of overall survival. So these results are important because they show that breastfeeding is safe in this specific population, and it represents an additional step to help find a balance between the maternal and the infant needs without compromising the oncological safety. So indeed, as you said, the adjustment for potential confounders was an important step of this analysis. And in our analysis, adjustment was made for all patients or tumor characteristics that were unbalanced between the two groups, as well as for all those characteristics that are known to be prognostic factors. So finally, our adjustment was made for country, smoking habit, grading, nodal status, hormone receptor status, and also whether risk-reducing surgeries were done or not. So for risk-reducing mastectomy after delivery and risk-reducing salpingo-oophorectomy, these two were also included in the model and were considered as time-dependent covariates. So it's important to underline that there is very little information available on this topic, namely the oncological safety of breastfeeding, and specifically in this type of population. So our cohort is a relatively unique cohort of young BRCA carriers with a diagnosis of early breast cancer at a young age, namely 40 years or younger. So these are quite unique data, and there is not much about this topic in the literature in a similar population. There was a very recent publication that I want to underline because the topic was similar, so I'm referring to the publication of breastfeeding in the positive trial that was recently published in the Journal of Clinical Oncology. And well, it's important to consider that in positive, the population was different because we are talking about women with early hormone receptor positive breast cancer who interrupted the endocrine therapy to attempt a pregnancy, so the population is different, but still the results were similar in suggesting that there were no differences in breast cancer related events in women who breastfed compared to those who did not. So different populations, of course, but similar results in saying that breastfeeding is safe from an oncological perspective. Well, yeah, indeed. Our results provide novel information to guide healthcare providers in the counseling of young BRCA carriers with a breast cancer history who desire to breastfeed their babies. And indeed, I believe our results are important really to pursuing, to try to find a balance between the maternal needs and the infant needs without compromising the oncological safety. So current guidelines nowadays recommend for women with a prior history of breast cancer these women are encouraged to breastfeed their babies, but it's true that there are no specific information available for young BRCA carriers who received the diagnosis of early breast cancer in a young age. So I believe that our results can provide really further important information for healthcare providers to inform them and to help them counsel these young women with a BRCA mutation who desire to breastfeed their babies. Yes, absolutely. So in the interpretation of our results, there are some limitations that should be acknowledged. And the first one is that it's related to the nature of this study. This was a retrospective observational study, and information on breastfeeding were collected from medical records retrospectively. And as I mentioned earlier, there were some imbalances in patients and tumor characteristics between the two groups, namely the group of patients who breastfed compared to the group of patients who did not. But it's true that our survival model was adjusted for all patients and tumor characteristics that were unbalanced between the two groups, and for all those characteristics that we know are prognostic factors. Another limitation is there were some missing information, especially also about breastfeeding, because this, as I said, was a retrospective real-world study. And also an important point is that this is a specific unique population of BRCA carriers, and therefore there were many women who underwent a bilateral mastectomy as a risk-reducing surgery. So for this reason, the sample size that allowed us to do this analysis on breastfeeding was relatively small, and therefore we cannot really drive strong and solid conclusions. But despite these limitations, it's important to consider that this is a very unique cohort of young BRCA carriers that represents a relatively rare patient population. And we evaluated a topic that is the oncological safety of breastfeeding, where there is very little information available nowadays.